Hello, I'm Dr. Anthony Wheeler, and I'm telling you everything that you need to know about pathology. This is an image right here of a PET scan of the brain in a person with Alzheimer's disease. We're going to be discussing this and other conditions that you must know in this presentation on neurodegenerative disorders pathology. This is covered in your book, Medical School Pathology and Step 1 Review. Everything that you need is in it to do exceptionally well on Step 1 and with your medical school coursework. You can scan this QR code and go to the website with your phone or whatever. I'm sure you're already online and all that because you're not a procrastinator, which is why you're here. I applaud your efforts. You're going to do great. That is why you're going to succeed. Let's discuss neurodegenerative disorders. Neurodegenerative disorders are degenerative conditions that affect the central nervous system. In this presentation, we're going to be dealing with a number of must-know neurodegenerative conditions. This includes dementia, Alzheimer's disease, vascular dementia, Pick disease, Parkinson's disease, Huntington's disease, normal pressure hydrocephalus, and spongiform encephalopathy. These frequently show up and are highly tested. Let's start with dementia. Dementia is an impaired ability of cognitive function. Cognitive functions that are commonly affected in dementia include ADLs, right? The activities of daily living, as well as memory, recall, thinking, and even basic decision-making. Dementias typically show loss of neurons within the gray matter, which is often brought on by protein buildup that harms the neurons. Degeneration of the brainstem and basal ganglia causes movement abnormalities, while degeneration of the cortex causes dementia. Alzheimer's disease is a degenerative condition of the brain, specifically the cortex. Alzheimer's disease is the most common cause of dementia. Patients with Alzheimer's disease may develop mutism and become immobile. They are also more prone to infections, which are actually the leading cause of death in patients with Alzheimer's disease. Early Alzheimer's disease does not exhibit focal neurologic abnormalities. The majority of Alzheimer's disease patients are sporadic and typically affect the elderly, and that's about 95% of the cases of Alzheimer's. The risk of developing Alzheimer's disease increases with age, doubling every 5 years after the age of 60 years old. Early-onset Alzheimer's disease is seen in familial cases of Alzheimer's disease and are associated with something that you must know called presenilin 1 and presenilin 2 gene mutations. And with that, good day. You finished a very short but very important lecture, another one in your repertoire. Keep up the good work, keep making us proud, and I'll see you on the next one. Till then, take care.